everybody, it's Dr. Jessie with a very important public service announcement which will help you avoid headaches, improve your overall health, and help you to get the most out of your frequency modality treatments, whether those are with Healy, with frequency-specific microcurrent, with Beamer, with laser or Skinar. And if you don't know what laser or Skinar is, be sure you don't miss Testimonial Tuesdays on the first week of June when I interview Daryl, who's going to go into all of those really interesting modalities which he's been using for years. Anyway, this is a public service announcement that helps you get the most out of using frequency medicine, and it's this: drink water. I know, you think you already drink enough water, and I'm here to tell you that you probably don't. Sorry to say, 75% of Americans are chronically dehydrated. So most of you listening right now are chronically dehydrated. So drink water. And I know you're afraid that if you drink more water, you're going to have to spend more of your precious time running to and from the restroom over and over and over again. And I'm here to tell you that your body will adjust. And if it does not, that means there's something up, and you probably should go and see a pelvic health physical therapist, which I will send, or I'll include a link in the comments below if you are interested in that resource. So drink water. And if you think water is another word for coffee or tea or Gatorade, it's not. You have to drink pure, unadulterated, no additives water, right? Tea, a lot of teas are diuretics. Coffee is certainly a diuretic, meaning it takes water out of your system. And things like Gatorade or Monster drinks or whatever have all sorts of additives that just are not healthy for our purposes when we're using frequency medicine. So you need to drink pure water. So drink water, because if your body tissues are dehydrated, the current that we use in these modalities just doesn't have a medium to travel through. So if you're dehydrated while you're using these frequency modalities, it's like a waste of your time. They're just not going to be as effective. And then you're going to come out of a treatment thinking, well, that didn't work for me, when really it's because your system wasn't optimized to be able to integrate the frequencies. So drink water. Clinically, I've seen people who are dehydrated end up with a headache after a frequency session. So it's so important to be hydrated. It just doesn't work if you're not. So here's an aside. If you're a frequency and health geek like me, you might want to check out the book called The Fourth Phase of Water by Gerald Pollack, and I will link to that here in the comments as well. He will literally blow your mind about how little we know about water and how absolutely essential it is to the human body systems. I'll also include a link to his TED Talk below too. It's only about 25 minutes and it's worth a listen. So I hope I have you convinced that drinking water is absolutely essential for the success of your frequency medicine treatments. But how much? How much are you supposed to drink? There's a lot of conflicting advice and evidence, and so I try to simplify it for you here. First, though, the National Academies of Sciences, Engineering, and Medicine determined that women need 11.5 cups of water a day, and men need 15.5 cups of water a day. So for women, that's 2.7 liters. For men, that's 3.7 liters every single day. So there are 8 ounces of water in 1 cup. So this is a beer glass filled with water, and this is 2 8-ounce glasses in one. So this is 16 ounces of water here in this beer glass. And here is a simple rule of thumb for when you're using microcurrent. Drink 4 cups of water throughout the 2 hours before your frequency medicine treatment. So that's 2 of these, 2 full 16-ounce glasses, that's like a beer glass here, of pure unadulterated water. Do not guzzle the water, right? You're going to sip it throughout the 2 hours before your session so that it has time to get into your system. Gulping the water is not nearly as effective, but it's better than being dehydrated. However, I really would recommend 2 of these guys in the 2 hours before your treatment session. So if you don't have a glass like that, and you have a water bottle, so like here's a water bottle that I didn't know how many liters was in this water bottle, but if I look on the bottom, it says 18 ounces or 532 milliliters. So most of your water bottles will say how much water is in the bottle on the bottom. So that's just a little tip that if you need to know, you can check the bottom of your water bottle. So for me, 2 of these before frequency medicine treatment is about the correct recommendation. That's a lot, right? That's a lot of water. And a lot more than I know I'm used to drinking. And I consider myself a kind of a health nerd, right? So anyhow, don't guzzle it. Drink 32 ounces in the 2 hours before your frequency medicine treatment, and then continue to drink water throughout the duration after your treatment, just for the best effect. Now, I want to mention one thing about drinking that much water, especially if you're not used to it. Many people are concerned about maintaining a healthy electrolyte balance. And in the clinic, especially as I encourage people to drink far more water than they're typically used to, we often recommend an electrolyte supplement. And I'll link to it in the comments. It's called Aussie Trace Minerals, and it's just the best product that we've found. So I like to share that with you all. 10 to 20 drops in, your 8 to 16 ounce glass of water is a good balance as you up your water intake, and it helps your body to assimilate it more effectively. And I should add that you really should speak directly to your healthcare provider, because these recommendations might change with people who have diabetes or hypertension or liver and kidney disease or heart disease issues or other issues. So be sure to check with your knowledgeable healthcare provider who knows your body so that they can make appropriate recommendations for dosage for electrolytes. So to recap, number 1, 75% of you, that's 7 or 8 out of every 10 people watching this right now, are chronically dehydrated. Number 2, frequency medicine does not work on dehydrated tissue. So you could even get a headache if you're dehydrated. So that's why I'm offering this information, just so you know. If you're getting a headache after treatment, you probably need to drink more water. Drink 32 ounces or 4 glasses of water or 2 beer glass sized glasses of water in the 2 hours before your frequency medicine session. That's throughout that time. And you might want to add electrolytes, but check with your healthcare provider to make sure. If you have excessive urgency with urination, whether you're a man or a woman, whether you are young or old, check into a pelvic health physical therapist, because they can really help you. They have very specialized training, and it's not normal to have leakage or have to pee every 5 minutes, right? But you should be able to tolerate this amount of water without that. So that's why I add that information, because a lot of people don't know. So I hope this finds you well. I hope you feel prepared for your first and forever frequency medicine treatments by drinking enough water. Cheers. Until next time.